Art can be awe-inspiring, fascinating, and thought-provoking. Art is all around us and in many different forms, although the real beauty of art is that it can tell a story without saying a word. And like art, those moderate to severe frown lines between the brows can also say a lot about a person.
It started to make me look like I was either concentrating too hard or I was a little bit stressed out.
I was home for Christmas and I was reading a book and my mom said, "You look like you're frowning."
I think it's because I started to look angry or something all the time because the lines were there.
Everyone has their own reason for speaking to their doctor about Botox Cosmetic. What's yours? Whatever the reason, you're here to learn about the art of Botox Cosmetic and what your doctor can do to touch up those moderate to severe frown lines between your brows. Hi, I'm Lisa Masters, and I'm here to talk to you about the one and only Botox Cosmetic, a simple, non-surgical, physician-administered treatment that can temporarily treat moderate to severe frown lines between the brows in people ages 18 to 65. Botox Cosmetic, botulinum toxin type A, is a true original. It's by prescription only, and it's the only treatment of its kind approved by the Food and Drug Administration. We've created this video to help you understand more about Botox Cosmetic, what it is, how it works, and how it can visibly improve the appearance of moderate to severe frown lines between the brows. After viewing this program and reviewing the important safety information, talk with your doctor about Botox Cosmetic to see if it's right for you. Only a licensed, trained healthcare professional can administer Botox Cosmetic. Now, let's cover the questions that are on everyone's mind. Botox, botulinum toxin type A, has been used therapeutically for over 16 years to treat a variety of medical conditions. It's approved in more than 75 countries and remains the most studied botulinum toxin and one of the most widely researched medicines in the world. The same formulation, with dosing specific to frown lines, was approved by the U.S. Food and Drug Administration in 2002 as Botox Cosmetic. After Botox Cosmetic injections, serious heart problems and serious allergic reactions have been reported rarely. If you think you're having an allergic reaction or other unusual symptoms, such as difficulty swallowing, speaking, or breathing, call your doctor immediately. Over time, movement of brow muscles causes the skin to crease. As skin becomes less elastic, repeated frowning creates lines and wrinkles between the brows. Botox Cosmetic is a purified protein produced by the Clostridium botulinum bacterium that relaxes the muscles by blocking nerve impulses. With a few tiny injections, Botox Cosmetic blocks the release of acetylcholine, the chemical that causes muscles to contract. With less movement, the facial muscles begin to relax, and the lines begin to fade. You'll still be able to frown, smile, or look surprised, but without the creases and wrinkles between your brows.
I'm very satisfied with the results.
My expectations were definitely met.
It was no big deal, and the results were just right on target.
This simple, non-surgical procedure consists of a few tiny injections and can be performed right in your doctor's office. No anesthetic is required. The first thing your doctor will determine are the places that need to be treated. Prior to being injected, these areas may be numbed with a cold pack or anesthetic. These are the sites where you can expect to be injected with Botox Cosmetic. Using a very fine needle, a tiny injection will be made into each site. Localized pain, infection, inflammation, tenderness, swelling, redness, and/or bleeding, bruising may be associated with the injection. Since there's no recovery time or downtime, you can even receive Botox Cosmetic treatment on your lunch break. And within days, you'll see a noticeable improvement in the appearance of the vertical lines between your brows. The most common side effects following injection include temporary eyelid droop and nausea. Now, let's hear from some patients who've experienced Botox Cosmetic treatment.
It was very painless. It only took about 10 minutes. I was out of there.
It's a very small little pinch that you feel, and I felt that it was really easy and much easier than I thought.
Thing about it, there wasn't any downtime. You know, like I could still go and do my errands. I could still do whatever I had planned for my day.
Serious heart problems and serious allergic reactions have been reported rarely. If you think you're having an allergic reaction or other unusual symptoms, such as difficulty swallowing, speaking, or breathing, call your doctor immediately. The most common side effects following injection include temporary eyelid droop and nausea. Localized pain, infection, inflammation, tenderness, swelling, redness, and/or bleeding, bruising may be associated with the injection. Patients with certain neuromuscular disorders such as ALS, myasthenia gravis, or Lambert-Eaton syndrome may be at increased risk of serious side effects. Full prescribing information has been provided to your doctor. You can expect to see noticeable improvements in a matter of days, and you may continue to improve during the first week after treatment. Optimal results should be visible within 30 days.
The results actually were very subtle. It took about 2 or 3 days to kick in.
You can still see expressions. I'm still frowning. There are still little fine lines.
With proper dosing of 20 units in the brow region, the positive effects of treatment can last up to 4 months. Ordinarily, you will only need to repeat the treatment 3 or 4 times a year. And treatment with Botox Cosmetic can be repeated as long as you continue to respond.
I've been doing it now for 3 years, and I love it.
I definitely would think that doing this every 3-4 months is not at all a heavy expense.
It just makes me feel like I did something for me.
According to a recent survey, most patients were satisfied with the results of their Botox Cosmetic treatment. And for 4 years now, Botox Cosmetic has been the most popular physician-administered cosmetic procedure in the United States, surgical and non-surgical combined, according to the American Society for Aesthetic Plastic Surgery. Think about your reason for talking to your doctor about Botox Cosmetic treatment, and together you can decide whether it's right for you.
I'm very satisfied with the results, and I'm satisfied with the whole experience.
Yeah, I'm very satisfied.
I will continue to receive Botox Cosmetic treatments.
I'm glad we could share a few moments together today. We hope we've helped you get a feel for the art of Botox Cosmetic and treating those moderate to severe frown lines between your brows. Thank you for your time, and please speak with your doctor if you have any additional questions.
Why ask your doctor about Botox Cosmetic?
This is my time.
Everyone has their own reason. Curious? Go to BotoxCosmetic.com to find a doctor nearby, because only a doctor can answer all your questions. What will your reason be? Ask your doctor about the one, the only Botox Cosmetic.
Isn't it about time?